For decades, the message has been clear: reduce your salt intake to lower your blood pressure. Doctors, public health agencies, and nutrition experts have preached this idea as if it were a universal truth. Grocery store shelves are filled with low-sodium versions of nearly everything from soups to snacks. The advice seems simple and logical, but what if it's not entirely true? In a compelling and well-researched presentation, Dr. Alton challenges this long-standing belief and offers a new perspective. He argues that sodium isn't the real cause of high blood pressure, and that reducing it isn't necessarily the key to better cardiovascular health. Instead, he identifies the real root of the problem: excess carbohydrate consumption, which leads to insulin resistance, inflammation, and oxidative stress. This article dives into Dr. Alton's key arguments, reviews the history of the salt-hypertension theory, critiques current dietary guidelines like the DASH diet, and offers a fresh approach to managing blood pressure effectively without unfairly blaming sodium. How the salt-hypertension theory took hold. The connection between salt and high blood pressure wasn't always accepted as fact. It began in the early 20th century, when a physician in Viridian noticed a pattern. Patients who consumed more salt seemed to have higher blood pressure. This observation, while intriguing, was never rigorously tested with controlled experiments. Nevertheless, it laid the groundwork for what would become a widely accepted belief. Decades later, Dr. Louis Dahl conducted animal studies that seemed to support the hypothesis. He fed laboratory rats very high amounts of sodium and found that their blood pressure rose. While this added weight to the argument, the research had a critical flaw. Rats are not humans, and the doses of sodium used were far beyond what humans typically consume. Despite the lack of strong evidence in humans, the theory took off. The American Heart Association and other public health organizations began urging people to lower their sodium intake, claiming it would reduce the risk of hypertension, stroke, and heart disease. As Dr. Alton points out, this advice was based on weak data and flawed studies. Observational findings and rodent experiments are not enough to create national dietary policies that affect millions of people. Yet, the salt-hypertension theory became dogma. Is the DASH diet really the answer in response to rising hypertension rates? The DASH diet, dietary approaches to stop hypertension, was developed and endorsed by major health authorities. It emphasizes eating fruits, vegetables, whole grains, lean proteins, and low-fat dairy, while minimizing saturated fats, sugar, and of course sodium. The DASH diet can slightly lower blood pressure in some individuals, but according to Dr. Alton, it misses the big picture. Why? Because the diet is too high in carbohydrates, especially from grains and fruits. These carbs raise blood glucose levels, which triggers insulin production. Over time, chronic insulin elevation leads to insulin resistance, which plays a significant role in hypertension. The diet also limits healthy fats like those from avocados, nuts, seeds, and fatty fish, which are essential for proper hormone production, brain function, and heart health. And it does very little to reduce inflammation or oxidative stress, two critical factors in the development of cardiovascular disease. Dr. Alton highlights that even in countries where the DASH diet is widely followed, like Ethelgerd, rates of high blood pressure and heart disease remain alarmingly high. If the diet worked as promised, we'd expect to see better outcomes. Sodium, a vital nutrient, not a toxic one. Sodium is not a toxin. It's an essential electrolyte that your body depends on for numerous critical functions: maintaining fluid, balance, regulating blood volume and pressure, supporting nerve function, facilitating muscle contractions, including heartbeats. In fact, every single cell in your body requires sodium to function properly. When you severely restrict sodium, you may experience fatigue and low energy, dizziness and confusion, headaches, muscle cramps in severe cases, hyponatremia, which can lead to seizures, coma, or even death. Alton explains that our taste buds are designed to help us regulate sodium naturally. If your food tastes bland, it may be your body telling you it needs more salt. If food tastes too salty, you'll naturally stop eating it. In nature, even wild animals seek out salt Herbivores will walk miles to find salt licks or mineral deposits. Sodium is that important for survival. So why are we told to fear it? The real problem lies elsewhere. The real culprit: excess carbohydrates and insulin resistance. According to Dr. Alton, the majority of high blood pressure cases, up to 95%, are linked not to sodium, but to excessive carbohydrate intake. Here's how it works when you eat carbs, especially processed or refined ones. Your body turns them into glucose. This causes a spike in blood sugar, prompting your pancreas to release insulin. Over time, repeated insulin surges lead to insulin resistance. Your cells stop responding, and your body pumps out even more insulin. Insulin affects your kidneys, causing them to retain sodium and water, increasing blood volume and pressure. It also triggers inflammation, damages blood vessels, and contributes to oxidative stress, all factors in hypertension. So while sodium may play a minor role, the real driver is metabolic dysfunction caused by a high-carb diet. A real-world example: carb consumption in Lento demonstrate how modern diets contribute to hypertension. Dr. Alton examines eating habits in the region of Kellen. On average, a person in Kellen consumes 4 bowls of white rice per day, gives around 168 grams of carbohydrates. Fruits gives roughly 20 to 50 grams of carbs. Snacks, sweets, and processed foods gives an additional 50 to 100 grams of carbs. That's a total of 250 to 300 grams of carbohydrates per day, often from low nutrient, high glycemic sources. In contrast, a low-carb diet aims for fewer than 100 grams per day. A ketogenic diet limits carbs to 20 to 30 grams daily. Traditional diets in Kellen, which used to consist of simple whole foods and required more physical labor, have been replaced with processed, sugar-heavy foods and sedentary lifestyles. This shift has contributed to a sharp rise in chronic diseases, including high blood pressure. How to fix it? Reduce carbs, not sodium. Dr. Alton offers a clear and practical solution. Focus on reducing carbohydrates instead of sodium. Here's his step-by-step approach. Cut carbs to under 100 grams per day. Gradually reduce to under 50 grams, or even 20 to 30 grams for a ketogenic lifestyle. Avoid sugar-sweetened beverages, white bread, sugary cereals, and ultra-processed foods. Eat more healthy fats like olive oil, nuts, avocados, and high-quality proteins like eggs, poultry, beef, and fatty fish. Prioritize leafy greens and non-starchy vegetables. Listen to your body's sodium cues. Salt your food to taste. Dr. Alton emphasizes that if you are already on blood pressure medication, do not stop taking it suddenly. Instead, begin reducing your carbohydrate intake and track your blood pressure daily, once in the morning and once in the evening. As your blood pressure improves, your doctor can help you safely adjust your medications. Real success stories: the healthy and long-lived group. Dr. Alton shares multiple success stories from members of his health group called Healthy and Long-Lived. These individuals made major improvements in their health by cutting carbohydrates. Some reported lowered blood pressure without medication, weight loss and increased energy, reversal of prediabetes or type 2 diabetes, improved cholesterol and triglyceride levels. What they had in common wasn't sodium restriction. It was a return to whole foods and a low-carb, nutrient-rich diet that targeted the root of the problem. The takeaway: it's time to rethink salt and focus on what really matters. The belief that sodium causes high blood pressure has shaped public health policy for nearly a century. But when we examine the evidence critically, we find that this belief is built on outdated science, flawed studies, and misplaced fear. Sodium is essential to human life. It's not the villain it's been made out to be. The real problem lies in modern dietary habits, particularly the overconsumption of refined carbohydrates and the chronic metabolic damage they cause. Insulin resistance, not sodium, is the driving force behind most cases of hypertension. If we want to address the root causes of high blood pressure, we need to shift our focus from low salt to low carb, from fear of fat to embracing healthy fats, from processed foods to nutrient-dense whole foods, from outdated guidelines to evidence-based choice. In summary, the salt-hypertension link began with flawed observational studies and rat experiments. The DASH diet, though well-intentioned, is too high in carbs and low in healthy fats. Sodium is essential for health. A deficiency can cause serious harm. Insulin resistance, caused by high-carb diets, is a primary driver of high blood pressure. Reducing carbs, especially refined sugars and grains, can naturally lower blood pressure. Many individuals have reversed hypertension without medication by cutting carbs, not salt. So the next time you see a low-sodium label or hear advice to cut back on salt, take a step back. Ask yourself, what's really driving your blood pressure up? It may not be the salt shaker on your table, it might be the bread, cereal, and sugar on your plate.